My thought on what public health is best expressed by a definition from the American Public Health Association, which is that public health promotes and protects the health of people in the communities where they live, learn, work, and play. So I think maybe the easiest way to describe public health is by giving examples of public health in action. For instance, public health accounts for 25 of the 30 years that we've gained in life expectancy over the last century, meaning that rather than living into our 40s, we're now able to live into our 70s and 80s, and that really is a direct result of public health. Another example of public health in action has to do with microbes and how we're at constant odds or a constant battle with microbes in our environment. Common examples that are things like flu and tuberculosis. Nowadays, flu and flu epidemics don't cause the number of deaths that they caused, again, a century ago when millions of people might die as a consequence. And today in the United States, as we see diseases like tuberculosis declining, in other parts of the world where public health controls are not nearly as tight, the disease of tuberculosis and deaths from tuberculosis continue to rage on. Other examples of public health include clean water. We take for granted every day that we're able to drink clean and safe water and not have a second thought about it. And yet, around the world where there are not such availability of clean and safe water, people die as a consequence of not having access to that water. A couple of other important examples are things like health behaviors. We're working hard in the United States because as we live to be older, a lot of the adverse health outcomes that we experience are the direct result of our own health behaviors. And so the public health community is working hard to look at ways to reduce those health behaviors that result in risks that cause us to have premature death. They include things like smoking, excess alcohol use, and other kinds of associated health behaviors. And lastly, for me personally, in the area of occupational health, we've worked hard in this country. It's been in the last century plus, it has been one of the explanations for our progress in public health that we have been able to reduce deaths related to the work environment. So our work environment is much safer now as a result of policy and regulation and safety measures that didn't exist decades ago that help us to live longer lives and that actually help us to come home from work in the same condition that we went to work. So those are some examples of what I believe public health to be.